Okay, I like to start off on one knee, palpate where you're gonna drive with the forearm first. Okay, I'm using my left elbow. I like to get really low here. Kind of get into a nice big wide lunge where I can kind of pivot. Okay, I'm driving the blade of the forearm here all the way to the elbow. So I'm starting off with a kind of like a knife. I'm driving up, really making contact with the blade and working my way all the way down until I reach the acromion. Once I really lock this in, I switch knees and then I drive into it. You can probably start off like this, but whatever floats your boat. Really hold this position. Notice my wrist is nice and relaxed. That's what you want. Because if not, you kind of lock this in, you flex all the anatomy on the forearm, and you kind of fatigue quickly. Okay, you're really driving with the core here, so squeeze the abs gently. Use my hand to support. My elbow does feel a little bit dry. I do prefer that because I can really lock into position. If you really notice, I pull the whole shoulder up with me. Notice that it's like maybe an inch worth of travel, an inch and a half worth of travel. That's what you want. That's how you know it's being productive. Take your time here. You can check in with your patient to see if they're tolerating the pressure well. She's really experienced, so I know what she can and cannot experience. Once you feel like you're making a little bit of progress, just let the natural glide of the body release the pressure. And it's not abrupt, it's nice and slow. Once you feel like you're really getting off the upper traps, you can start to stand up here and create a nice, big, broad pressure down through the rhomboids. Okay, I'm not using the tip of the acromion, not the tip of the elbow. I'm using maybe an inch to an inch and a half below that. So a little bit more in the blade region right here, not here. Hold for 5 to 10 seconds if you find a stubborn spot. I sometimes turn my arm maybe like 30, 40 degrees. It just gives me a little bit more leverage. I notice that it kind of fits the contours of the scapula a little bit more. Did find a little trigger point here. So all I'm doing is I'm going back and forth and traveling maybe an inch across the rhomboid. Taking it nice and slow. Resetting once I kind of reach the end. I'm strumming it here. And at this point, I am using a little bit more of the tip of the elbow on purpose. Okay, when you are using the tip, you are delivering more acute pressure. So dial it back just a smidge. It's just as productive. Okay, that's enough. I'm going to soften that angle on the elbow and work our way down the back. Working the whole length of the longissimus here. I notice that if I glue the edge of my fingers along the edge of the hip, it secures my position a little bit more. Just let it naturally ride the contours of the body. Once I start getting towards the pelvis, I create a 90-degree bend in the elbow, really internally rotating my shoulder, getting nice and low, and driving into that SI joint. Sometimes I like to kind of support this hand and just help it along a little bit more where I feel stuck. Okay, I'm not pushing the acromion along the edge of the bony landmark. Kind of keeping it a little bit more on the blade's edge, a little bit more of the muscle belly of the forearm flexors here. Okay, readjust and you're going to cut across towards the QL. Okay, we're driving towards the table, so we're going straight down here. Palm up, grip, and just take it nice and slow. Good. And gently lift, drag the elbow back. I like to really anchor right of the connections of the rhomboid and the lower traps. Clamp your hands and drive some strong pressure towards the body. If you can remember, your pressure wants to go through the body, not glide over the body. And that's the game changer because it feels very intense and broad. That's what you want. Not using the apex of the elbow here. Keeping it just 1 inch to 2 inches below the acromion. Okay. I'm going to run the length of the blade of the forearm. Finish off with the palm. Elegantly finish with the other hand, across the scaps. And rinse and repeat. We'll do that one more time. We'll take our time. Sometimes what I like to do is grab a little bit of like a towel, paper towel, whatever you got, and wipe off some of the lubricant first. And that kind of creates a little bit more tack, or gives you a little bit more grip. I'm just going to rest that there. Same thing, palpate to kind of see where to start, be clear. You want to get nice and low so you can lunge. Start with the fingertips, cut across with the pinky, drive with the whole blade of the forearm. You want to get it 1 to 2 inches right below the pointy part of the elbow. To feel that locking in, I like to switch and drive. You're lifting the shoulder off the table. Sometimes this gives you a slightly different pressure if you just kind of let the arm hang off there. Push it and just kind of rotate it if you need to. Readjust and just like that, let that get long. Kind of pulling across here, kind of pulling it apart if you will. Not really gripping, but just a slight rotation of the humerus here is really tasty. Okay, once you feel like it's starting to release naturally, we're not forcing anything here, we're really taking our time. You're going to start standing, keep your arm nice and straight. Boom, nice clean pivot. Start to angle the fingertips towards the hip there. Once you get close enough to make contact with it, do it because it keeps you nice in a straight line. If you kind of keep your arm parallel to the spine, you notice it's a little too hard to stay on the longissimus, the kind of tubular, anatomy here on the erectors. So that's why it's kind of important to kind of shift towards the hip. Good, I can feel her taking a nice big breath. That's a non-verbal cue that she feels what I am doing. It's really important to tune into that stuff. Getting into the thoracics here. I'm starting to make contact with the hip. Nice and gentle. Drive down. Beautiful. Okay, really start internally rotating the arm. Get low. We're not using the tip of the elbow. We're using the blade part of the forearm. Pull this down a little bit just so y'all can see it. Okay, get nice and low. Drive into the SI joint. We are slightly traversing over the pelvis here, but not by much. Okay, make your way back. Readjust. Start with the whole blade. If you want, you can fully reset. Start with the pinky, go into the blade, drop into the elbow, turn your palm up, clamp it, and just take your sweet, sweet time. Okay, a little bit more acute, so I'm bending it, creating an acute angle with the elbow. Should be tender. Feel it's a little stubborn spot. We're just gonna release it. Good. Make your way back. Elegant as always. Okay, once you should feel where the rhomboid and the trap really merge. You'll be able to anchor into that. Once you find that, turn the wrist, clamp it, and drive. You're going straight down into the table. So it makes it really, really, really deep. Good. You watch your body rise and drop. Those are big breaths. Good indicators that she feels what you're doing. And she's right about her limit. Take it nice and slow. Drive to the blade. Palm will return the hand. Finish the stroke at the trap. Neck. Boom. That was awesome. Felt good, felt confident. Okay. We're going to spend a little extra time on that kind of right hip here. We're going to do the same deep tissue strokes, starting at the traps, working our way down, traversing over the QL region of the right hip. Same thing. Get nice and low. We're going to start off with some palpations first to figure out where we need to start. Okay, we're going to really lock this in. You don't want to be aligned with the head. You want to be off to the side a little bit more. Okay, your shoulder and her shoulder should be same alignment. Okay, we're going to start off with the blade, the pinky, drive up. Blade of the palm, blade of the forearm. Keep driving. It is a little dry. We want that. If you feel like it's sticking, just hold it a little bit more. Okay, lock in under it. And we're driving up. Okay, notice I'm kind of creating a little bit more of an acute angle with the elbow. And I'm pulling up. Okay, you should watch this whole thing lift. If that whole thing is lift, then you're doing it right. Breathe. Play around, rock back and forth a little bit. Okay, lock it in and pull. Okay, we're gonna pivot like a fulcrum. Nice and smooth to the top. Soft wrist. Nice big breaths. Okay, it's feeling a little dry for me. We're not trying to drag the skin. So if you feel like you need to apply a little lubricant, this is a good time to do so. I'm gonna let this go nice and smooth. Keeping one hand on the body. Kept it on the floor. Okay, the smallest amount. Okay, what I like to do is rub it in the areas I'm not really working. And then the area I'm going to work. So I get the majority of the lotion and oil off, and I leave just a residual in the area because I don't want it slippery. I just want a little bit of glide. Okay, it's your choice if you want to reset the stroke or not. I'm just gonna pick up where I left off here. Same thing. Oh, that's perfect. Okay, nice and chill wrist. Hold for 5-10 seconds. Little pro tip, if you want to take a deep breath on your exhale, make sure you turn away from your patient. You don't want to breathe on them. You don't want your breath or you don't want to accidentally spit on them. So it happens, but just try to remember when you take a deep breath in, slightly off the table. Find a little stubborn spot, create an acute angle. Hold that for 5-10 seconds. You can even do a little cross fiber with the elbow. Back into the obtuse angle. As soon as you can make contact with that right hip, do so. Kind of keeps the elbow locked in. Good. Okay, we're reaching the lumbar region. Pivot around 9 degrees in the elbow. Internally rotate the shoulder and drive the blade into the lumbar region. You almost want to think about this like a decompression almost, okay? If you got the balance and you got the core strength, use your other hand and pull a little bit of traction, really separating that fascia there. This is a game changer. It doesn't have to be much, just nice and subtle. Hold that for 5-10 seconds. Cool, bring it back, just a smidge. We're driving with the blade through the pinky, through the palm, through the forearm. Not making contact with the spine and driving across the QL region. Remember, this is her problem area. So take your time here. We'll do an extra deep tissue stroke in this area. Once you kind of feel like you're kind of falling off the QL, reset. You don't have to go all the way down to the table. Need a little bit more room for my hands. I'm going to swing your arm off the table here. Perfect. Notice I kind of turn my palm down. You can press like this for some stability. You can turn it up. Use your other hand for support. Completely up to you. Good. Pull a little bit of traction in the opposite direction. Good. We're going to do that one more time. Going all the way up. Nice big effleurage running down the body. Once I hit that pelvis, just pivot, turn, use the blade, make it into the forearm, get towards the elbow. I'm going to turn and support my other hand here. Oh, that's yummy. Good. Okay. Make our way back. Like I taught you. Nice and broad. This is not deep. This is just a return stroke. But once you feel like you're locking in to that area of the lower trap, kind of creates a little triangle along the scapula there. Once you find that little triangular piece right here, that's where you're locking into. You're going to lock in there. Nice and broad. You're pulling back. Supinate the arm. Lock your hands together. And nice and smooth. If you feel like your patient's holding their breath, you can always remind them to take a deep breath. Because when they do that on the exhale, you're really driving some extra pressure. There we are. Sometimes if you give them a little tap, that's an indicator to breathe, but make sure you tell them that because they're not doing like, why do you keep tapping me for? So nice gentle tap. I'll take a deep breath. You lock in your position a little bit more. Yummy, yummy, yummy. Okay. We're going to throw in some deep ironing into that right hip there. So we're going to reposition ourselves. Nice big effleurages to glue everything together. Finish at the neck. Focus on the right hand side here. Nice and smooth transitions as per usual. Okay. I want you to just plant a fist right in that SI region. Okay. The top of the thumb is on top of the pelvis. That's where you're going to lock in your position. Once you do that, hold this for maybe, I don't know, 5-10 seconds.